Crow's feet, bunny lines, 11s. In a single word, wrinkles. They're inevitable. No one reaches an advanced age without a wrinkle or 10.
So wrinkles are caused by a lot of different factors. They're caused by sun damage. They're caused by the facial expressions we make. They're caused by gravity, the fact that we just stand most of the time straight up. And also they're caused by just the overall loss of collagen and elastin in our skin.
Sun damage and exposure to environmental toxins such as tobacco smoke are mostly responsible for the fine lines and wrinkles. Furrows are deeper lines that are caused by repetitive movement. Make a face for 40 years and your mother is right. It will stick like that, or at least the furrows will. While most people seek wrinkle treatment in their 40s and 50s, it's never too early to think about the health of your skin.
It's very variable, and if you look around, you'll see that there are teenagers who, maybe from looking at their iPhones and their computers now, you're seeing with the glabellar lines. We sort of learn from looking at our parents, so if our parents frowned at us a lot, then we'll probably learn to frown a lot too. If you start early and you start trying to keep the collagen active and not let the collagen recede over time, we feel that by using fillers and some procedures such as lasers earlier in time, we can keep the body from losing as much collagen, and so to sort of stop aging. Maybe not that you're 35 now and you want to look 20, but if you're 35 now and you still want to look 35 when you're 40, that's good. So it's almost to sort of keep us looking good, not to make you look 10 years younger, but to make you look good for whatever age you are.
Early prevention includes things we should all be doing anyway. Every skin regimen should include applying a moisturizer that contains sunscreen in the morning. Never smoke, but if you do, quit. Drink plenty of water and enjoy foods that nourish the skin, such as lean meats and fruits and vegetables. Take care of your skin, and if those emerging wrinkle lines start to bother you, then you can try additional treatment.
To get into treatment or early prevention, sometimes the retinoids can be very helpful. Tretinoin and retinol creams, some over-the-counter. There's a zillion creams out there, and it's very, very daunting to try to sort out on, especially if you look on the internet, there's so many things, and there's not a lot of science behind a lot of it. A lot of it is anecdotal evidence or studies that really weren't done that carefully. But the most science is behind the retinols. If your skin can tolerate them and you include sun protection with them, they can certainly help to keep the skin looking young.
Often, it takes a combination of cosmetic procedures to acquire the best results. So when you find that wrinkles are outpacing the creams in healthy living, there are simple medical procedures. Resurfacing procedures use various techniques to remove the top layers of the epidermis to even out pigmentation and improve skin texture.
For sun damage, we need to resurface the skin. And so for those, we might use a peel or a microdermabrasion. Sometimes if we want to go a little deeper, we use a procedure called microneedling, in which tiny little needles are placed very rapidly into the skin. It almost doesn't hurt. It feels almost like a kind of a massage, and that stimulates new collagen so that we get rid of some of the old cells and we can replace them with more youthful, more healthy-looking skin.
Then there are implantation procedures where temporary or permanent fillers improve or erase the appearance of wrinkles.
For the facial expressions, the most effective treatment is a Botox or a similar toxin that's injected into the lines. Usually we use that in the upper part of the face, and that can be very, very effective temporarily to relax the muscles that make us make these kind of faces and make you look a lot younger and more relaxed. For the loss of volume that people get just with intrinsic aging, we inject fillers such as Juvederm or Restylane or some of the brands that were used. Those are injected usually into the lower part of the face. They can replenish the volume that gets lost with age and to help give us smoother lines.
While it's impossible to prevent wrinkles entirely, it's best to live a healthy life and avoid all those factors that exacerbate wrinkles.
Sun damage is going to make people get a lot of fine wrinkling. Smoking, it deprives the skin of oxygen, so especially the lines around the mouth, besides the fact that when people smoke, they're pursing their lips all the time, so they're always using those muscles. In addition to that, there's lack of oxygen in the skin around the mouth, so they're going to get wrinkles that are worse. Sometimes people who are not in good health are going to see more wrinkles. If the skin is very dry, it's going to look more wrinkled, and if it's dehydrated, so that's why using a good moisturizer and drinking enough water is also part of a good beauty regimen.
Try not to let the lines worry you. For one, worrying might make the worry lines worse. For another, never underestimate the power of a happy face, even if it's wrinkled. As Roald Dahl once said, if you have good thoughts, they will shine out of your face like sunbeams, and you will always look lovely. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.